It's just the first one. Doesn't really need the slides. So
Why don't you do the first one?
Yeah.
Do that one first.
But I've got some handouts for you. I wanted to first of all just ask, did all of you receive these from Fluoride Free New Zealand before Christmas? We dropped them all.
Yeah, I recall.
All three of you have
Yeah,
been
we've
given one of
had
those.
quite a lot of literature.
And so this is the handout for my presentation.
Thank you. If you just give it to Megan, she'll pass it around.
Yes, one of those each, please. Is there a focus?
Yeah, there will be because I can't see it.
I'm not going to worry about that, just know we'll just start on the first one that doesn't matter. Big crap.
This is the one with the previous ones.
Yeah.
Shall I wait for?
No, no.
You're ready to go for it?
Yeah.
Thank you for having me speak today. My name is Lynn Jordan. For the past 6 years, I've been the communications volunteer with the non-profit organization Fluoride Free New Zealand, and I'm the Fluoride Free Wellington coordinator. I have a BA in English and Media Studies, which has been handy for work on this campaign and my volunteer work. My paid work is my private practice as a neuromuscular therapist in Wellington now for 20 years. And I'm the volunteer list administrator for over 340 New Zealand health professionals opposing fluoridation. So first I'm going to talk about political process and what you're facing with this bill. Thanks very much. This one just goes back and forth. Okay. So political process. We can't expand on something that doesn't work. And as you were saying, Scott, you've heard a lot now, 3 days of submissions about how much this doesn't work. Leading international fluoride expert and science researcher Dr. Shushila has published about fluoride's harm to thyroid, metabolism, and fertility widely. Ingested fluoride also damages intellectual function, bones, and can cause depression and anxiety, as you've heard. For 70 years, the various fluoridation theories have been discarded even by its own advocates. We now know fluoridation does not work. More on that later in my second presentation. Fluoridation advocates give you no quality information to support fluoridation because it doesn't exist. They bring you genuine pleas for help, but only give you simplistic rhetoric and misleading information. It's now just a desperate attempt to protect fluoridation's reputation and to protect public trust in those that endorsed it in the 1940s but haven't let it go yet. The New Zealand Ministry of Health has now quietly admitted many of fluoride's failures, including the latest. This is the now discarded theory of fluoride's incorporation into child's growing tooth enamel. We all now agree, fluoride advocates as well as us, agree that this does not prevent decay. They also admit that it's causing a rate of 41% or more of dental fluorosis in the United States and New Zealand, which is fluoride poisoning. One committee member mistakenly said last week, DHBs are in the best place to evaluate programs like the Child Smile program, but the DHBs will not do this. They are a branch of the Ministry of Health contractually obligated to carry out Ministry of Health policies. DHBs battling fluoridation will eclipse the rest of their priorities, wasting time and money that should be spent on other things. So, the Public Health Association of New Zealand is funded by the Ministry of Health, if you want to just turn to page 2 of this handout. Before the last 2 DHB elections, the Public Health Association said that their top priority was, and still is, water fluoridation, even above drunk driving and gambling. Last year, they published a scorecard on 4 criteria for DHB candidates before the elections. Top of their list was if the candidates were pro-fluoridation. They went as far as to bully the DHB candidates, publishing a shocking scorecard on their website to their thousands database. With these facial emojis on the top 4 priorities, the candidates that opposed or even raised a question about water fluoridation got the dead emoji next to their names. You've had at least one submission from a DHB member. I don't know if you have heard this submission. I believe she gave it in private recently. She told of how she's been silenced and intimidated by a few of her DHB
I'm not
colleagues.
sure that we could even begin to hear second-hand information about submissions that have been heard in private.
Okay. I know of a DHB member who's told
Yeah,
herself.
Yeah, but
Okay.
what?
That's fine. I'll move on.
Yeah.
You can expect other massive battles like the PHA bullying and others, particularly in the non-fluoridated areas of New Zealand, if this bill passes. 93% of the written submissions on this bill oppose it and oppose fluoridation. I counted the first 600 the week that they were uploaded and read them. Most of the 7% that supported fluoridation somewhat or strongly didn't support this bill, and they had important amendments that they wanted to suggest and criticisms for it.
Now, we just about, your original time, so you're sort of branching into the next one?
Last paragraph in the
Great, excellent.
Child Smile works. It's proven. You have the power to draft new legislation to start Child Smile in New Zealand. It's a win for everyone, most of all, our children. It saves thousands of teeth, saves pain, saves millions of dollars, like non-fluoridated Scotland is doing with this program. Instead of passing this bill and being the bad guys to 50% or more Kiwis that don't want fluoridation, you can be heroes to everyone with Child Smile instead. Okay. So, next presentation. If you